everyone. It's Nurse Chris for your annual Universal Precautions in the school setting. What are universal precautions? They are usual and ordinary steps all school staff must take in order to reduce the risk of infection. Exposure occurs through contact with infected body fluids. These are a list of all body fluids, and you can read those over. Bloodborne pathogens are germs that are carried and spread through the exposure to blood. These are three bloodborne pathogens that are serious: hepatitis B, hepatitis C, and HIV. We need to all protect ourselves universally. That means that every child is treated the same as if they could be infected, and we need to use some thought process and plan ahead for an exposure. Universal precaution steps. You want to use PPE, gloves mainly. We need to know how to decontaminate. Hand washing is a big step, and disposal. Always wear gloves when in direct contact with body fluids. It's not easy to anticipate this, so you should probably carry a set with you. Nosebleeds, bleeding abrasions, that type of thing. Handling clothes that might be soiled with urine, feces, vomit, or blood, and diapering children. Gloves are always a one-time use. If they're not immediately available, use a barrier such as paper towels. When you take your gloves off, you peel them so the germs go inside, and then you discard in a trash container. Always wash your hands after removing gloves. Decontamination. My big thing is to call the custodian if you have questions, and they will come and clean up the spills. Always have gloves on. Discard gloves and any contaminated material in a lined trash container, and wash your hands. The most important step is washing your hands. Use liquid soap or warm water. Wash vigorously for at least 20 seconds. Rinse under warm water. Turn the faucet off with a paper towel, and dry your hands thoroughly. Waste disposal. I usually will take the bag out of my trash can and take it to the janitor's office, and they dispose of it. There are sharps containers in all nurses' office if you need a sharps container. And then again, wash your hands after removing your gloves. Accidental exposure. Go ahead and alert your supervisor, complete an employee injury report, and follow up with the district's workers' comp medical provider for confidential evaluation.